Hello, everyone. Thank you for joining us today. I'm Erica Harquist, Public Health Division Communications Officer with Oregon Health Authority. Today, we are talking about Measure 110 funds now in the hands of local communities. And joining us today is Tera Hurst, Executive Oregon Health Justice Recovery Alliance. She's with the Executive Oregon Health Justice Recovery Alliance. Steve Allen, Behavioral Health Director at Oregon Health Authority. Sabrina Garcia, a tri-chair on the Measure 110 Oversight Accountability Council, and Basilio Sandoval of Centro, Latino, Americano in Lane County. This is a friendly reminder to please mute your audio and use the raise your hand function if you'd like to be added to the queue to ask a question. And as you heard, we're granting permission to record for all of you one by one, which, as you know, can take a bit of time. So we do appreciate your patience after you ask us for permission to record. And now we're going to get things started. Let's go ahead and hear from our first expert, Tera.
Thanks, Erica. Good morning. My name is Tera Hurst, and I'm the Executive Director of the Health Justice Recovery Alliance. We are the statewide advocacy organization fully focused on implementing the will of the voters when they pass Measure 110, to make sure that in every part of the state, we have more treatment, more housing, more life-saving services, and ultimately more hopeful futures for people in our communities who struggle with substance use. I'm excited to share this morning that all funds for Measure 110 have been approved and are being released to providers across the state. These funds will expand critical services like overdose prevention services, low barrier treatment, supportive housing, peer and mentor support, and more. The Oregon Health Authority reported that in only 6 months with early Measure 110 funding, providers were able to provide more than 16,000 people to receive care. And so here's a couple examples of what that looked like. More people are alive in Marion and Lane County today because the HIV Alliance used Measure 110 funds to directly reverse over 500 overdoses. Bridges to Change, who was about to close their doors in Wasco County due to the pandemic, was able to save their recovery house there and expand their presence in the Dalles. And the Miracles Club was able to double their staff to support their outreach efforts to the African-American community. CORE in Eugene was able to increase their street outreach to high-risk youth from 4 times a month to 4 times each week. These things and more happened thanks to an initial $30 million investment. And I think it's important to just imagine the impact this remaining $265 million investment will have. Soon, every community in all 36 counties across Oregon will have access to a full range of services to help meet people where they're at, address their trauma, and provide the vital supports needed to heal and recover closer to home in that person's first language and by someone who understands and shares their culture. Measure 110 is just the first step in providing the communities most traumatized by the war on drugs with the tools they need to heal. We have spent more than a half a century putting people in prison rather than offering them treatment. We've seen just how ineffective, broken, and cruel this previous system was. It was a system that ripped apart families. It was a system that systematically targeted people of color, arresting and giving them harsh sentences at disproportionate rates when compared to their white counterparts, even for low-level, nonviolent drug offenses, even though white people and people of color use drugs at the same rate in Oregon. It was a system of shame and stigma, of wait lists and being turned away for help because you didn't have the right kind of insurance, or you couldn't pay, or because there were simply no beds and the wait list was long. Oregon voters recognized that it was time for a more effective approach. We passed Measure 110 into law by an overwhelming margin in 2020. And 2 years later, new independent polling shows that Oregonians still believe that drug use is a healthcare issue and not a criminal one. And they affirmed that they believe Measure 110 is how we get there. Measure 110 is just getting started, and Oregonians want Measure 110 to remain in place. Today, we celebrate the massive community investments that this law is making possible. We celebrate how Measure 110 is creating a reality where being in crisis no longer means going to jail, but instead getting connected with support. And we celebrate that thousands of Oregonians struggling with drug use will now be able to get help without fear of arrest and without fear of criminal records that make it harder, even years into recovery, to secure housing, employment, education, and many more. We're creating a system of care that's rooting for you instead of against you. So joining me today to tell you more about how we're working to fulfill the promise of Measure 110, as Erica said, is Steve Allen, Behavioral Health Director at the Oregon Health Authority, who's going to update you on OHA's spending schedule to transform Oregon's behavioral health system. Sabrina Garcia, a tri-chair on the Measure 110 Oversight Accountability Council, who will describe how the lived experience of council members has guided its decision-making. And Basilio Sandoval, Executive Director of Centro Latino Americano, a Lane County culturally specific community-based organization that works to empower Latino families. Basilio will share how Measure 110 funding is enabling them to scale up programming, provide housing for more community members in early recovery, and increase the reach of its recovery mentor program in Lane County. Today, I'm especially proud of my vote for Measure 110, and I hope that you are too. Our state is finally taking real steps to invest in services that save lives. As a person in long-term recovery myself, who has personally lost people to addiction, this is the first time in a long time that I've had hope for Oregon's recovery landscape. I look forward to everyone working together so that we can make the program even stronger and ensure that Oregonians are accessing the right care at the right time and in the right setting for them. And now I'd like to turn things over to Steve Allen, who can talk about where Measure 110 fits within the larger behavioral health system strategy.
Thank you, Tera. I'm Steve Allen, Behavioral Health Director with the Oregon Health Authority. I want to echo what Tera said. We've reached a true milestone. Measure 110 funds are in the hands of local communities. Now is the moment that Measure 110 truly begins. This is a turning point for Oregon and for our nation. Earlier this month, OHA announced the completion of funding awards for the last of the 44 behavioral health resource networks established under Measure 110. These service networks now exist in every Oregon county. They offer a comprehensive array of community-based, culturally specific services for people seeking treatment for drug use and substance use disorders without regard for ability to pay. OHA is fully committed to working with the Oversight and Accountability Council, network providers, and our community partners to fully see through and implement Measure 110. During the initial Access to Care grants, including the initial Access to Care grants, the Measure 110 rollout has now totaled more than $302 million. This funding offers local providers a new, substantial, and flexible source of funding that has never previously been available. The road to get here has not been easy. Oregon is the first state to try such a bold and transformative approach as Measure 110 to address the nationwide substance use crisis. Until now, much of the public attention on Measure 110 focused on the difficulties encountered during the early phases of implementation and getting money out the door to community providers. There was a lot of learning on the fly during a time that COVID-19 pandemic was depleting Oregon's behavioral health care workforce, diverting critical resources, and driving a spike in demand for these services. We understand and acknowledge the frustration this caused within our communities, among service providers, and among people seeking behavioral health services. But when you do something for the first time, you're going to make mistakes and often learn hard lessons. At OHA, we've learned that we need to give our partners on the Oversight and Accountability Council more support. We need to speed the distribution of funding and to be ready to give more technical assistance towards Measure 110 implementation. Yet, despite these ups and downs, we've reached this pivotal moment. Measure 110 is launching and will provide critical supports and services for people, families, and communities. Supporting these networks and helping them save lives is a top priority for OHA. Funding Measure 110 is a key part of OHA's broader work to fully transform our behavioral health system to better serve the people of Oregon. And the latest update to OHA's Behavioral Health Investment Report reflects the speed in which funding is now flowing to meet these needs. By the end of this month, OHA will have spent or obligated $845 million of the historic $1.35 billion the legislature appropriated for the 2021 through 23 biennium to transform the behavioral health care system. In just this last quarter, OHA spent or obligated a total of $322 million. We will continue to push out remaining funds with a key focus on moving more workforce incentives, getting federal approval on new provider rates for behavioral health services, and providing more resources for new behavioral health housing and treatment beds. We expect to spend or obligate an additional $291 million by the end of 2022, which would mean over 84% of the $1.35 billion appropriation. Let me say that again. By the end of this year, OHA will have spent or obligated 84% of the $1.35 billion the legislature appropriated for the 21 through 23 biennium to transform the behavioral health care system. In addition to Measure 110, that money is funding these vital priorities: improvements to our statewide crisis care and support system, treatment and housing support for people who are not competent to face criminal proceedings due to the severity of their mental illness, expanding residential settings for people with serious and complex behavioral health conditions, funding to retain and replenish the behavioral health workforce, funding to coordinate access to career development, encourage workforce diversity, and incentivize culturally responsive and linguistically specific services. We still have a lot of work to do. Measure 110 will continue to be a learning process. The behavioral health system continues to recover from the COVID-19 pandemic. Measure 110 will support a more effective and coordinated strategy, but it won't solve all of our problems overnight. Methamphetamine and fentanyl pose threats to too many lives. Too many people still need housing. But for far too long, we've relied on law enforcement as our primary response to these problems, and the results of that has been a complete failure. But with Measure 110, Oregon is once again leading the nation by forging ahead with an innovative, community-driven approach. Now we will have more resources for harm reduction, treatment, and other services that will give people seeking treatment for drug use and substance use disorders the services and support they need to live safer and healthier lives. But it's going to take time before we see dramatic changes in the quality of life. This is a critical first step. Now we have more than hope. We are building a new, better coordinated, locally driven system backed with resources to make treatment and other supports available for more people. This is a game changer. Let me conclude with some final words about Measure 110. I'm proud of the work that's been done, and I want to express my profound gratitude for the hard work and dedication by the Oversight and Accountability Council, along with our community partners, OHA staff, and leadership in bringing Measure 110 to realization. Now let me pass it to our Council Tri-Chair, Sabrina Garcia.
Good morning, and thank you for having me here. My name is Sabrina Garcia. I am an enrolled tribal member of the Klamath Tribe. I am a Tri-Chair for Measure 110 Oversight and Accountability Council. I am a Prime Plus Certified Recovery Mentor #2 at Transformations Wellness Center, a substance use treatment disorder program that provides harm reduction and peer support services in Klamath County. Like many of my colleagues on the council, I have lived experience in substance use. The council is a highly diverse group of 22 community leaders, including people who have lived experience with substance use or substance use disorders, medical professionals, and tribal representatives. This shared living experience perspective was valuable in shaping our decisions around Measure 110. For those of you who may not know, the role of the council is to determine how the grant funds are distributed and ensure that the most effective services are being funded. OHA provides support and assistance. One of our tasks was to come up with the funding formula with weighted factors that considered for each county: the population of Medicaid patients, the houseless population, the number of drug arrests, and the number of overdose deaths. We also selected providers to form behavioral health resource networks. Providers in the networks, through shared agreements, will coordinate care to offer culturally responsive and linguistically specific services that include screening and comprehensive behavioral health needs assessment, individual intervention planning, case management, and connection to additional services, low barrier substance use treatment, peer support, mentoring and recovering services, housing services, harm reduction, intervention, and supported employment. There is at least one network in every Oregon county. In May, the council approved the first network located in Harney County, and on August 31st, the final network was approved in Jackson County. In our decision-making, the council worked diligently to honor the intent of Measure 110 to provide low barrier treatment and support services in a centralized way. We prioritized service delivery to communities that were the focus of the creators of Measure 110, people most impacted by the war on drugs, and African American, Black, Latinx, and all people of color. Prior to Measure 110, thousands of people were not able to get the support they needed. The coordinated networks will make sure services are available through trusted community providers. This will lower barriers and enable more people to obtain the treatment and support they so badly need. Now that the funding process is complete, the council has approved processes for monitoring grant recipients and ensuring that services are provided in an efficient way. These include requiring grantees to periodically report service data and fiscal data, requiring grantees to submit their service delivery policies and procedures, performance audits and reviews by Oregon's Secretary of State, a requirement for OHA certification of community health workers, peer wellness specialists, and peer support specialists working within the networks, and a similar requirement for outpatient substance use disorder treatment and recovery programs. We know that there was a lot of disappointment about the early pace of our work, and I share in that disappointment. But the reality is you can't fix a system that is broken in just 18 months. What we can do over the next 18 months is support these networks by making sure they operate as intended and make sure there is a stable source of funding. I deeply believe with the promise of Measure 110 and the work that we are doing to reform Oregon's system of treating substance use and substance use disorder and support those seeking help. I am committed to ensuring that funding remains available to complete this important transformation that will lead to compassionate and caring system that will break the chain of substance use disorder and support those who are still using substances and provide people seeking help with the resources they need to become self-reliant. And with that, I'll pass this along to Basilio, who will tell us how Measure 110 funding is already making a difference in Lane County. Basilio?
Sorry, I didn't know I was muted. Okay, well, thank you, Sabrina. My name is Basilio. I'm the manager for the Substance Use Disorder Program at Centro Latino Americano, a nonprofit organization serving the Latinx immigrant families in Lane County. The mission of Centro Latino Americano is to support the lives of Latinx and immigrant community members by creating a safe space that fosters leadership, education, wellness, and connection. With that, we envision an equitable and thriving intercultural community. Our organization provides Latinx immigrant families with a wide variety of services. This includes substance use disorder treatment, family leadership program, community gardens so families can grow their own organic food, and support for people to start small businesses and more. We were thrilled to learn in August that we had been approved for Measure 110 funding. And we are one of 3 behavioral health network resource networks in Lane County. And we're the only Lane County network that is culturally specific and serving the Latinx community. Being part of this network allows us to expand our services beyond our previous capacity through a steady source of revenue. Through Measure 110, we are receiving approximately $4.5 million. And this money we are receiving will make it possible to expand recovery and mentoring programs, provide free outpatient treatment and mental health services to more people, establish community partnerships through a collaboration with HIV Alliance. Through this collaboration, we can expand the scope of services from testing, education, and to harm reduction, and moving them further down the path of recovery. And help clients meet their basic needs so they can focus on the recovery. Expand access to housing in partnership with Willamette Family, and also providing a rental assistance, and even pay for gasoline for people we serve, so the lack of access to transportation is not a barrier to access critical support services. This Measure 110 money is especially important because the hard reality is that our organization is the only Spanish language provider of these services in Lane County. And maybe more significantly, Measure 110 makes it possible for us to provide this service free of charge. This allows us to reach people we could not serve previously because of the lack of insurance, which is a barrier. It also allows us to extend this service and support to their families. This is the key because of supportive family members can influence recovery behavior. Every single staff in our substance use disorder team is fully bilingual. And because of this, we can provide more equitable services in our community. Okay, so also because of this funding, we will be able to move our recovery treatment services to a bigger space where we can make our essential services available to even more people. This will enable us to hire more staff. We will now have the resource to keep our 4 peer support specialists, something we would not otherwise be able to afford. In addition, this Measure 110 dollars will allow us to provide wraparound services to every client who walks through our doors, helping them access peer support specialists, mental health therapists, substance use disorder counselors, and connecting them to our community resources. Our new building will bring together services that were previously scattered. At a single location now, we will be able to provide confidential, safe space for our clients and host recovery activities for our clients and their families. Thanks to Measure 110 funding and the power of collaboration that Lane County is known for, we will expand services for a population that is often overlooked, but equally deserving of meaningful care and treatment services. In conclusion, Measure 110 funding will forever change the system of care in Lane County and expanding services for a population that has been historically underserved. We can now provide meaningful, responsive care that will make it more possible for more people to achieve a life-changing recovery. Well, I want to thank you for letting me tell our story.
Great, thank you so much to all of our guests and participants today. Again, a reminder to please use the raise your hand function if you'd like to ask a question. And Eduardo Hernandez with Univision is the first question, so go ahead, Eduardo.
Thank you, Erica. Basilio, ¿le puedo hacer una pregunta en español? Creo que está muteado.
Claro que sí, gracias.
Sí. Bueno, mucho gusto. Y bueno, preguntarte, yo seguramente sé que ya lo ha dicho en inglés, pero para nuestra comunidad hispana que nos sintoniza, preguntarte, estos fondos de la medida 110, básicamente, ¿cómo serán utilizadas para esa gente que está pues batallando con una adicción, con uso de sustancias. Básicamente, nomás nuevamente explicar eso de cómo serán utilizados estos fondos para ayudar a nuestra pues, comunidad latina que, como mencionó, creo que pues a veces está marginada y que a veces por el tema de la barrera del lenguaje, a veces no saben que hay recursos disponibles para un familiar, para hijos que a lo mejor están pasando por este tipo de situación.
Bueno, muchas gracias por la pregunta. Una de las cosas que es importante tomar en cuenta es que, primero que nada, es importante para nosotros también tener la habilidad de hacer, de poder ir o sea, diferentes eventos alrededor de la comunidad para poder, vamos a decir, dar a saber a nuestra comunidad de los servicios que tenemos disponibles. Eso es bien importante para poder ayudar a nuestra comunidad a que puedan ellos darse cuenta de que este es un recurso para ellos, para poder ayudar a que tengan éxito en la recuperación, pero también de cierta manera poder proveer esa información a la comunidad de que el uso de sustancias es algo que realmente está presente en todas las familias y es importante poder proveer esa información para que ellos sepan en dónde estamos. Segundo, ahora con la medida 110 vamos a poder incluso proveer apoyo a esas familias que están luchando para mantener, digamos, desde lo que viene siendo necesidades básicas, poder ayudarles incluso con la ayuda con la renta, mientras la persona que está en el programa pueda gradualmente lograr la recuperación. Pero esta recuperación tiene que ver con incluir a la familia para que esta recuperación sea a largo plazo. Y eso lo podemos lograr a través de la medida 110. Es algo que realmente no habíamos podido hacer en el pasado por falta de recursos, de fondos, ¿verdad? Entonces, ahorita a través de esto vamos a poder lograr muchas cosas, incluyendo hacer actividades con las familias y los clientes en una manera confidencial y segura para que ellos puedan lograr el éxito y de esa manera poder hacer la diferencia en las generaciones que vienen hacia el futuro, poder apoyar a las familias a través de educación y a través de realmente estar aquí para continuamente proveer esa realmente ese recurso y poder realmente lograr la recuperación en nuestra comunidad. Y estoy contento y lo doy gracias a todas las personas que han trabajado en que se haya logrado esta medida. Gracias.
Y nomás rápido, dijo que recibió 4.5 millones.
Correcto,
Ok,
4.5 millones. Ajá.
ok, bueno, nomás quería aclarar eso. Ok, muchas gracias. Thank you,
Okay.
Erica.
Sí.
Finish.
Yes, thank you so much, Basilio, for responding in Espanol too. That's super helpful. Okay, our next question comes from OPB, Amelia Templeton. Go ahead, Amelia.
Yeah, I have a question about access to treatment on a county by county basis. You've said that every community will have access to a full range of services. Access can mean a lot of different things. It can mean that somebody connects you to a treatment bed in a different part of the state, or it could mean services are available in your own community. And so I guess I'm trying to get to the bottom of that. Is there medication-assisted treatment available in every county statewide currently? Is there inpatient substance use disorder treatment available in every county statewide?
This is Steve Allen. I can take an initial response to that question. So you're absolutely right. Access means the person is able to receive the services they need when they need them, and we're far from that in some areas. What Measure 110 does is provide new funding for a system that has been depleted of the workforce, the residential treatment facilities, medication-assisted treatment, as you mentioned, for far too long. These funds are going out to providers who are willing and able to provide the broad array of services that are funded under Measure 110, which include peer support outreach, housing supports, employment supports, assessment, substance use disorder treatment, and so forth. And so these services will become greatly strengthened over the course of the next 18 months as these providers stand up these services.
Can you be clear about at a sort of county level where the gaps currently are, though, when it comes to the local availability of treatment and treatment beds?
So I see Tera's also coming online, but we are in the midst of a statewide assessment of substance use disorder supports and services. That report is due, I think, in January ahead of the next legislative session. So we'll have a much more detailed response. We know that currently, however, those services are inconsistent county by county, which is exactly why Measure 110 was structured in the way that it is, to provide that same wide range of broad services in every county region.
And Tera, I saw you go on camera. I don't know if you had anything to add with regards to that OPB question.
I mean, it depends on if Amelia feels like that was satisfied. I would just add that I think it's important to recognize that this is a huge milestone, and it's a really important step in the right direction. And we have been, hoping to see a landscape, like Steve said, about where we're at and what each county has. What I think is important for folks to know and understand is that what Measure 110 is building is really this opportunity so that if somebody doesn't have to go across the state to go to a treatment center when they could be better served with stable housing and maybe outpatient services or MAT services or a peer support and supported employment. It's really about meeting folks where they're at and making sure that we have the kind of non-stigmatizing and trauma-informed care. And as Basilio talked about, how important it is to make sure that we're also really building the services linguistically specific and culturally specific around the state, like they're doing in Lane County. So, there's a long way to go, and what it means on the ground in each county is really going to be different because every community's needs are very different. But you're looking at folks who will finally be able to get into a bed in a house that is supported housing with the treatment services that they need. And maybe that's reunification with their children and having parenting courses and parent mentors. It just really depends on the person. And so it's really important that we create this wide array of services. And that's what Measure 110 is really funding and building, that support network and infrastructure. And this kind of money is about 5 times what we've spent previously on non-Medicaid services. So this will have a huge impact on our state. We have to give it time and our providers time to really set up this infrastructure, buy the houses, and the furniture and everything else that needs to happen. But I think the thing that we can celebrate today and moving forward is that those funds are getting into the accounts to the people who can really make a huge difference.
Great, thank you so much. And thank you for that question, Amelia. Our next question comes from Christina, I hope I'm saying this right, Giardinelli with KTVL in Southern Oregon. Go ahead, Christina.
Yeah, thank you so much for taking questions. I wanted to ask, are you tracking any statistics on how many people caught with hard drugs by law enforcement and referred to these help services are actually seeking help?
Yeah, this is Steve. I was wondering if Tera would take that question. I know that data is being collected, but it's incomplete at this point, and I'm not sure if we have that the data available on this call. I think we can go back and send you what we have. afterwards. Tera, did you have additional detail on that? That's not something I've been tracking.
It's on the Oregon Judicial Department. You can they publish it. I think the latest numbers are from August. I think that it's important to recognize that, you know, the reason the voters wanted to get it from away from a criminal justice approach to a healthcare and health-based approach is because law enforcement has not always been the most effective way to help people get connected with services. So the hotline has been really the most important during the pandemic and in the early days of 110. And we need to continue the hotline because I think it's important to make sure that people have access across the state to a 24/7 hotline when, you know, if it's because they have a citation, but more importantly, it's because they need help. If we had relied only on citations, 16,000 people wouldn't have gotten the services that they needed. And that's really what Measure 110 is about, is making sure that no matter what intervention is needed and no matter how somebody gets to a door or a phone, they are able to receive the care that they need. And that's what this is setting up. So the latest numbers I looked a couple of weeks ago, but so I can't quote you on that, but I know that the OJD website has all of that under Measure 110. And so you can definitely take a look at that. The other thing to note in that space is that we still don't have a uniform citation. So not everyone who's getting a citation is maybe even knows what number to call or why. And remember that when even if you're stopped by a police officer for a speeding ticket, you're generally a little bit more stressed, maybe not paying attention as much to what they're instructing you to do. So it's not surprising to any of us, I think, that there are less contacts to the hotline and more contacts to community-based providers who are trusted in their community and are known and have those relationships.
Can I ask a quick follow-up question?
It's like,
so public safety officials have been.
I was going to build on Tera's response, but do you want to ask your follow-up first?
Sure, whatever's better for the flow here. Public safety officials have been complaining that this is sort of taking out the stick from the carrot and stick method. Do you believe that that was a tool to help to compel people to seek services? And what is substituting that tool in this method?
So I think that if we had 50 years of incarcerating people for using substances, and if that had been effective, we wouldn't be in the position we are in today. We have more people incarcerated and more people addicted. So no, there's plenty of studies out there that show that forced treatment and coerced treatment are not only ineffective, but they can also be really harmful to folks. They have harmful outcomes. And so I think that really just building a system of care to make sure that people who need access can get access. It's also important to recognize that we have a system where even if you were arrested, especially with just a small possession of drugs, which is what we're talking about. We're talking about a very small amount of drugs, a personal day use, basically possession. You weren't getting help. All you were getting were barriers to with a criminal record, right? So you were having a harder time getting housing, a harder time getting employment, bank accounts, student loans. So I think that it's, we're not replacing a system that was working with a new system. It was a failed, cruel system that we are now replacing it with a system of care with a lot of evidence-informed, evidence-based practices that we know have positive impacts on people and really do build a longer-term road to recovery, if that's where people are at. So it's apples and oranges. We didn't have a good system or we wouldn't be in the position that we're in today. And we are building a system that is really focused on getting people what they need instead of, punishing folks for having a substance use issue.
And Steve, did you want to add to that, or did Tera?
I think Tera covered it. Yep.
Great. And my apologies, Christina. I know that you're with K2. Sorry about that. Our next question comes from Kevin McNamara with K2VL. Go ahead, Kevin.
Yes, my question, I guess, is kind of jumping off that then, now that funding has been set up and there's these resource networks, is there going to be more of an emphasis on outreach and, using that money to maybe get more people into the system without that law enforcement element than that, as you're saying, is sort of not as effective?
Yeah, that is part of the strategy. And I think Basilio talked about it when he was talking about the outreach workers that he's going to be able to hire. We know across the state, I talked to an outreach worker at Miracles Club last week who has been able to go out and work with especially women who are, experiencing homelessness to try and help meet their needs and place them in services if that's what they're looking for. These are our outreach workers are people with lived experience. And like Sabrina said, that's so important when you're talking about really connecting people and meeting them where they're at and having an effective strategy at working with someone who is, in trauma and is in crisis. Law enforcement isn't always the right response for crisis and trauma. So there's, most of the organizations that I'm aware of are hiring outreach workers. These are peer mentors. These are certified recovery mentors. These folks have been trained on how to do that outreach in a way that is that will help somebody long term. That's part of what's so exciting about all of this is knowing that community contact is going to be happening, and that not just the community contact, but also recognizing the money that we're putting into housing supports, whether that's an actual supportive housing unit or if that's a motel voucher to get somebody off the streets and make sure that they have the care that they need and can get connected. I know that there's an organization in Eugene that works with, pregnant women who are experiencing homelessness. They are now able to support those women and make sure that they have safe housing as they work with them to make sure that they can keep the women safe and build a family. So really important work that's happening. And that's why we're so excited about this.
Thank you for that question and for that response, Tera. Our next question, I see follow-up questions have started, but our next question comes from Andrew Selsky with the Associated Press. Go ahead, Andrew.
Hey, hi, everybody. Thanks for the opportunity here. To let us know where we are with this. So this is a lot of money being laid out for this, but not to put a damper on things, but what if people just don't come seeking help to get off drugs? And what will be, as you measure the participation and engagement of people, what will be the benchmark for measuring success or failure overall in this Measure 110 effort? Thank you.
I was not sure, Tera, if you wanted to take that one, or if you would like me to take the first.
Why don't you take the accountability piece, and I'll talk about whether or not folks will access the services. So I can go first on the services piece. I think, Andrew, if you look at the fact that only when 10% of the money went out, 16,000 people were accessing those services, it's a good indicator that people want services. People, when you are ready for help, having that help available, making sure that all the systems are available to support someone are key and critical. It hasn't been an issue that people are saying we don't want support, we don't want help. It's been that either there hasn't been any support out there, we've been put on long waiting lists, and therefore, we're just not able to get to these things. So I do think that, I'll let Steve talk about kind of the
Well, just the 16,000 number, isn't that mostly harm reduction, like needle exchange, not people trying to get off drugs?
Well, I think that 60% was harm reduction, which is, yeah, it's making sure that people are staying alive who are using drugs and making sure that they're given some of the tools that they need so that they can also stay out of the ERs with wound care kits. But it's ultimately about overdose prevention and making sure that, you know, when somebody accesses harm reduction services, I think the CDC said that they're 5 times more likely to be on a path to recovery at some point and get connected with treatment. So we can't expect someone to go from A to Z. We have to, that's when we talk about meeting folks where they're at. It's so important because everybody's different on their treatment plan and on their treatment path. And if we try and make this a one size fits all system, which we have done in some cases, so many people are left out. So yeah, 60% of funds and services at that time were going to making sure that we had outreach workers out in parks, making sure people are staying safe, protecting family members, loved ones, neighbors, friends, cousins, whoever that person is that got an overdose reversed, means that they're sitting at the table now. That's important. They can't get to treatment. They can't get more services and get off drugs if they're dead. Sorry, go ahead, Steve.
Yeah, on the accountability front, the statute itself, Senate Bill 755, incorporates a series of required measures, and that includes for each of the burn providers to keep track of the number of people that they served, the wait times, if there's reasons for denial for the services, how long people stay in care, the demographics. And it also requires us, the OHA as a state, to track potential impacts that might be statewide, for instance, overdose rates. Now, I think it's important to be cautious about how to interpret those data when they become available, because we're in the middle of a surge in overdose rates. And so we're at the agency level aren't expecting Measure 110 to suddenly reverse all of that, but getting more care in the hands of people that need it, we think is smart policy and will save lives.
When do you think you would see an impact, for example, in overdose rates, which of course shot up in 2021?
Well, I think that's exactly what I'm saying, Andrew, is I think it's really hard to predict that because there's competing forces at work. The drug supply clearly has an impact on it, but at the same time, what we're really concerned about is that we make sure that people have access to the care that they need. That includes harm reduction, treatment, assessment, outreach, housing supports, all of the pieces of Measure 110 we think will make a meaningful difference for people, and we think it can offer a significant benefit in the midst of this uptick in overdoses, which is quite concerning.
And it's going to take a while. Sorry, just one last follow-up. And I'd like to, Basilio in his presentation talked about all the fantastic plans that they have there, but it's going to take a while to build a new center, et cetera. And that's probably true for many burns around the state. So how long do you think before until those are put in place, construction, hiring of staff, before we'll see an impact, not necessarily in overdose rates, but start to see a turnaround in Oregon?
I think what we would expect is a gradual but differential roll-up of services. And as you suggest, where construction of a building or remodeling is intended, those will be delayed because it just takes a while. I will say that I was involved in discussions with most of the burns across the state, and these providers are excited, and many of them have a running head start on services, already began their hiring process for services. Folks were really raring to go. So some of the services will get started, have already been started. Others will be phased in over the next 6 to 12 months. So I think it's going to be an evolving story over time, but we're grateful for the resources here in Oregon.
Thank you.
Thank you for those questions. Okay, now we're getting to more follow-ups to, but I see there's a new question from Joe Ranieri with KGW. Go ahead, Joe.
Hey, good morning, guys. Hey, quick question. Can you kind of go to a couple quick ones? Real quick, just tell me some of the services you guys are going to be able to provide now with all this money. And I just want to double check the money that you guys have now from the passage of the bill.
I got the first question, but you were breaking up a little on the second one. So I'll answer the first and then go to the second. So we have a Measure 110 Behavioral Health Resource Network website that includes all of the services and supports. So essentially 7 different components: assessment, treatment, harm reduction, peer support services, housing supports, employment supports. I think Tera may help me, or Sabrina, if I'm forgetting one or two. But that's the array of services. And what I really appreciate about that array is that folks, in some cases, are reluctant to get into just treatment. And what we know about treatment is treatment alone is not enough for many individuals, especially with more complex conditions. And so having those additional supports and services in addition to treatment, we think is just the right combination. Not sure if Sabrina or Tera want to jump in, and then I can take the second question if you could restate it.
I do have a list of services, Steve, if you wanted me to add them. I'm not quite sure which ones you said. I was trying to pull out my paper, but I could read them off really quick. One is screening and comprehensive behavioral health needs assessment, individual intervention planning, case management, connection to additional services, low barrier substance use treatment, peer support, mentoring and recovery services, housing services, and harm reduction, intervention, and supported employment.
Perfect, thank you. And hopefully you can hear me a little better, Steve. Apologize if I couldn't hear the last question, but with the passage of Measure 10, how much funds will be made available right now? I think you guys talked about it earlier, but I just want to make sure I have it right.
Yep, the total is $302 million, and that includes over $30 million in the initial round of access to care grants, along with approximately $265 million in burn funding.
Thank you, Joe. Our next question comes from Zach with the Bend Bulletin. Go ahead, Zach.
Hey there, yeah, thanks for the time here today. I'm wondering how much you think about or worry about kind of the public perception of Measure 110 or public support for Measure 110. I think a lot of people in Oregon know about and perhaps have seen the decriminalization aspect of Measure 110. But they perhaps haven't seen or haven't heard as much about some of the work that you're talking about here with the resource networks, just because of the time that it's taken to get some of those services stood up. So how much is that public support? How important is that public support to the work that you are doing? And I guess, what is your message to folks who maybe have lost faith in what they were promised 2 years ago, just because they haven't seen it yet?
Thanks, Zach. I can take the first part of this, or take the first stab at this. I don't know if you saw last week, an independent poll had just been released that actually shows that Oregonians still very much support Measure 110 and want to see it completely, sorry, I'm missing my words right now, completely stood up. And so they, they also showed that voters support all of the different components of Measure 110, which is really important. So all of the things that Sabrina listed, including the had at least 90% support, including the decriminalization, which was a little bit less, but still a majority of support from Oregon voters just last week. So I think that it's important as we move forward that this is a bigger story. It's not just about whether or not we're criminalizing people. We have already reduced thousands of barriers for folks just because they don't have that criminal record due to having a small amount of drugs in their pocket. That's important. But what's more important, or just as important, is all these services that are getting stood up And it's incumbent on all of us to make sure that that message is getting out and that we're telling those stories and that we're, talking to the different providers in our local communities about how this is impacting them on the ground. So I do think that we sometimes think that there's a louder bubble around us when it comes to what we're hearing, but what we saw in this poll is that actually voters are really still on board with Measure 110, proud of their vote, and still support it. And it was about the same amount of people that supported it in 2020 when it passed. So it was pretty overwhelming.
Thank you for that. Thank you for that question. And Steve, did you want to offer a response, or do you feel that Tera?
I think Tera covered it well.
Tera covered it again. Okay, we've got a follow-up question from Amelia Templeton with OPB. Go ahead, Amelia.
Yeah. Can you clarify what Measure 110 funding cannot pay for in the treatment universe, given that this is cannabis tax dollars? And can you clarify how much of the 300 odd million is going to treatment, whether that's inpatient or outpatient, medication assisted or not, versus the other types of supportive services, harm reduction, and wraparound services? And I'm not asking this to denigrate those other services, but if the funding model here is that we're using cannabis dollars for the wraparound services and we're going to continue to use the Medicaid program to pay for treatment, I think we need to be clear about what the model is.
Yeah, I can take that. It's pretty straightforward, and it's incorporated into the legislation. Senate Bill 755 is Measure 110 funds are meant to pay for things that people need that aren't paid for through other means. And as you described, for anyone with either commercial insurance or on the Oregon Health Plan, we have a system of supports where the CCOs on a fee-for-service basis, treatment and professional services already have a means of being paid for. And so those Measure 110 funds then go for things that health insurance doesn't cover and won't cover. And there's specific language about Measure 110 funds not supplanting other sources of revenue.
And can I ask, is there any thought to revisit that, given how profoundly many people feel we need an expansion of the nuts and bolts of the healthcare part of this system, and how many people feel the funding through OHP and Medicare isn't adequate to support that?
Well, so we in the legislature have agreed that behavioral health rates were insufficient, and so the legislature authorized in the most recent 2022 session an additional investment of $154.5 million that will be augmented through federal financial participation in our Medicaid rates, which will result in about a 30% on average increase in behavioral health rates across the system, which is a huge increase and much needed. And we believe that that level of increase will help stabilize the system that we have, help encourage other providers to come to the table, and help provide long-term support for workers, which is also needed.
Thank you for that question. Our final question comes from Christina, again with K2, and this will be our last question as we're already at the noon hour. Go ahead, Christina.
Thank you for taking more questions. You mentioned that incarceration is not the best tool when it comes to addiction, when it comes to helping people with addiction. I have personally talked to people who said, if it weren't for getting arrested, I would probably not be alive today. So this may not be the best tool, but with the lack of services that you mentioned that still exist in many counties, it may be one of the only tools. So is Measure 110 taking simultaneously trying to beef up services, but also taking away one of the few tools that does exist, being, incarceration that some people say does help?
And I think it's important not to diminish anybody's experiences in that space. I think it's important as a society to also reflect on, is that what we want, is to have to incarcerate people for them to get access to healthcare and the services that they need. I think in reality, Measure 110 hasn't touched those services. What the folks who were going to prison and are still going to prison for drug-related crimes, for larger possession crimes, nothing that hasn't been touched. All we're talking about with Measure 110 is a small possession, and those aren't folks that were getting connected with services. Those weren't folks that were going to, jail or prison and getting treatment. And it's also really important to look at the data of the population, of our prison population, how many people have a substance use disorder and how many beds are available. And the last I heard, and this is not a fully vetted statistic, is that we had about 9,000 inmates and only 239,000 that could receive and probably qualify for services, and only 235 beds. We do not have a system that is treating people, period. Measure 110 is putting $302 million into a system that will get people access to care and care that they need on the ground, and including housing. So I think that it's just a misnomer to say that, not that people got help when they were in prison or hit a bottom when they were in prison. I know many people who have that story, and that's a real story. The point is that I don't think that we should incarcerate people to get them to that place and add trauma and stigmatization and more barriers for them when they get out. And it's really important to recognize that what we're talking about with decriminalization is a small personal amount of drugs. And those are not the folks that were getting connected to services, or even more than likely spending time in jail or prison.
Thank you so much. Thanks for that question and that good response. All right, and that will wrap up today's media availability. We will be sending a news release, as we often do after this news conference, with talking points and several helpful links. And as always, you can contact OHA if you have any follow-up inquiries. And I want to thank all of our expert guests for their time today, and you, our media partners.